Welcome to the course 40 Psychotherapy Approaches. In this course, I'm going to explain 40 different psychotherapy approaches to you. You can use these approaches integratively in your therapy practice. I'm a qualifying psychotherapist living in Ontario. I work with clients with different mental health issues and I use integrative approach in therapy. You can check out my website here. The first therapy that I want to talk about is accelerated experiential dynamic psychotherapy. AEDP is a mind-body psychotherapy. This model of psychotherapy incorporates techniques from experiential therapies. It was initially developed as a psychotherapy to treat the effects of childhood attachment trauma and abuse. It is an effective treatment for complex PTSD and attachment issues in adults. AEDP explains how psychotherapy can affect a positive change in a client's overall well-being. It uses emotion processing, which is a series of steps that changes the quality of emotions that a person experiences. AEDP has two central premises. First is that disorders of emotion and relationship are rooted in an early childhood history of traumatic emotional states that are not relieved by a caregiver. Second is that humans are biologically wired to positively respond to healing interventions and are wired for psychological resilience. Second therapy that I want to talk about is acceptance and commitment therapy. Acceptance and commitment therapy is a form of psychotherapy and a branch of clinical behavior analysis. It uses acceptance and mindfulness strategies and commitment and behavior change strategies. The objective of ACT is not elimination of difficult feelings. Rather, it is to be present with what life brings us and to move toward valued behavior. ACT invites people to open up to unpleasant feelings and to learn not to overreact to them and not to avoid situations where they are invoked. Truth is measured through the concept of workability, or what works to take another step toward what matters. Core principles of acceptance and commitment therapy. The first one is cognitive diffusion. Learning methods to reduce the tendency to reify thoughts, images, emotions, and memories. The second one is acceptance. Allowing unwanted private experiences to come and go without struggling with them. The third principle is contact with the present moment. Awareness of the here and now, experienced with openness. The next principle is the observing self, accessing a transcendent sense of self, a continuity of consciousness which is unchanging. The next is values, discovering what is most important to oneself. And the last one is committed action, setting goals according to values and carrying them out in the service of a meaningful life. Let's talk about Adlerian Psychology. Alfred Adler, a psychiatrist in Vienna in the late 80s, developed Adlerian Psychology. Adler shifted the grounds of psychological focus from sex to one based on the individual evaluation of the world. According to him, a person has to confront three forces: societal, love-related, and vocational forces. These confrontations determine the final nature of a personality. Adler based his theories on the pre-adulthood development of a person. He laid stress on such areas as hated children, physical deformities at birth, and birth order. Adlerian psychology believes that humans are primarily motivated by an inferiority complex. An individual derives his or her personality traits from external factors that arise out of drive for superiority. The character of the individual is formed by his or her responses to their influence. Compensation is a tendency to make up for inferiority of physical or mental functioning. Overcompensation reflects a more powerful impulse to gain development beyond the normal range. This may take a useful direction toward exceptional achievement. Undercompensation reflects a less active, even passive attitude toward development that usually places excessive expectations and demands on other people. The primary feeling of inferiority is the original and normal feeling in the infant, and it usually acts as an incentive for development. However, a child might develop an exaggerated feeling of inferiority as a result of physiological difficulties or bad parenting. The secondary inferiority feeling is the adult's feeling of insufficiency that results from having adopted an unrealistically high or impossible goal and perfectionism. The fourth approach that I want to talk about is animal-assisted therapy. Animal-assisted therapy, or AAT, is an alternative or complementary type of therapy that involves animals as a form of treatment. The goal of AAT is to improve a patient's social, emotional, or cognitive functioning. Our attachment to and interest in animals stems from the strong possibility that human survival was partly dependent on signals from animals in the environment indicating safety or threat. If we see animals at rest or in a peaceful state, this may signal to us safety, security, and feelings of well-being, which in turn may trigger a state where personal change and healing are possible. 6 neurotransmitters that influence mood have been documented to release after a 15-minute interaction with animals. Let's talk about art therapy. Art therapy is a distinct discipline that incorporates creative methods of expression through visual art media. There are 2 main ways that art therapy is employed. First one is analytic art therapy. This approach focuses on the client, the therapist, and the ideas that are transferred between the both of them through art. The second is art psychotherapy. This approach focuses more on the psychotherapist and their analysis of their client's artwork verbally. Art therapy can be used to help people improve cognitive and sensory motor function, self-esteem, self-awareness, and emotional resilience.